Hi, Dr. Don Hayes, DC here to talk to you about the EndFlame program. If you're interested in a new technology that helps you do what you're currently doing better and more efficiently, that can be easily implemented and integrated into your overall treatment protocol and can significantly improve your patient outcomes, then EndFlame is for you. Now be sure to watch this video to the end because I'm going to show you how to get an EndFlame fingerstick blood test and a personalized 3-page lab report at no charge. Plus, you're going to learn how easy it really is to offer the service in your office or by sending the tests and supplements directly to patients at home. Everyone knows the adage, seeing is believing, but with EndFlame, the message changes to seeing is knowing. In an evidence-based world, doctors need to show the difference they're making with their treatments. All too often in practice, we end up just talking about how much better things are when we could be showing the impact that we're making with blood tests. Now, EndFlame allows you to show what a great job you're doing on all patients, no matter what type of musculoskeletal injury they have. As a chiropractor who owned 4 clinics for over 20 years, I can say without a doubt that I dealt with inflammation every single day on every single patient, as maybe you are. Now, a recent study from Harvard revealed that resolvins derived from omega-3, EPA, and DHA serve as the body's natural stop signals to inflammation. Now, think about that for a second. A molecule that's made by the body's immune system on demand at the time of an injury from omega-3, EPA, and DHA, according to Harvard, is the body's natural stop signal to inflammation. I immediately flashed back to private practice and I found myself thinking, hey, if I had the opportunity to do then what can be done now, wow, what a big difference I would have made in patient outcomes. Currently, if you want to test the blood for inflammation, you would request something like maybe a C-reactive protein test for inflammation associated with infections, possibly a homocysteine test for cardiovascular inflammation, or maybe even a hemoglobin A1C for inflammation associated with elevated blood sugar. But as good as these tests are, none of them are really specific for musculoskeletal injuries, even though they may show an elevation in general. So what's the best way to use blood to support the monitoring of musculoskeletal injuries? By using a blood test that doesn't measure inflammation at all, but instead it acts as a surrogate marker to test for resolvins, the very molecule Harvard discovered and is now saying is the body's natural stop signal to inflammation. I'm talking about taking 1 drop of blood and using the EndFlame test to determine if a patient has an EPA and DHA deficiency. Now, the omega-3 index and the omega-6 to omega-3 ratio act as a surrogate marker for resolvins, those tiny molecules that are floating around in the blood that have been found to shut down a fired up inflammatory response. Frankly, come on, hey, there's nothing that we have in our chiropractic tool bag to deal with an omega-3 deficiency. But there's plenty that we can do if we understand Harvard's research on how to use a dual-pronged approach when treating acute and chronic inflammation. Now, most doctors know what turns on inflammation. In my case, it would typically be an injury, but we just don't really know how to turn it off. Well, Harvard professor Dr. Charles Sirhan spent 25 years researching how to turn off inflammation. He's the one who discovered resolvins. And he's the one who determined that they turn off both acute and chronic inflammation. The resolvin discovery is a huge game changer for practitioners that deal with physical injuries and muscle and joint inflammation. Sirhan discovered that in order to make resolvins and turn off inflammation and then take an acute injury to complete resolution, you must have a reservoir of EPA and DHA in the bloodstream between 8 and 12%. Now, if a patient doesn't have an omega-3 index of at least 8%, they'll not be able to make resolvins. They'll now be able to mitigate inflammation, and their injuries will heal, but guess what? They're going to heal with either scar tissue or they'll develop into chronic inflammation, regardless of what kind of treatment was provided. So what's the dual-pronged treatment approach to treat inflammation? Well, researchers say that the best way to resolve trauma-induced inflammation is by using both local and systemic treatments in tandem. For instance, at the local site of injury, let's say a neck sprain, a practitioner can provide mechanical therapy, such as chiropractic care and physical modalities to treat the local inflammatory cytokines, while also at the same time providing systemic biochemical therapy that utilizes personalized therapeutic doses of EPA, DHA, and polyphenols to make resolvents to support the turning down of the inflammatory response. EndFlame is the centerpiece of the dual-pronged treatment protocol. It acts as a surrogate test to measure and manage trauma-induced inflammation, and then recommends biochemical therapy to support the reduction of the body's inflammatory response. I mean, it works for all types of musculoskeletal inflammation with either new or active patients to support muscle and joint pain and improve treatment outcomes. The test itself is supported in science with more than 200 studies and over 100 different peer-reviewed journals. Implementing the program is easy. It has both subjective and objective components, and everything that's needed to conduct the finger stick test at home is included inside the kit. Patients fill out the subjective EndFlame survey in the office or at home by email. The doctor then uses the survey score to recommend the EndFlame test and the starting dosage of the two anti-inflammatory supplements. The patient conducts the finger stick blood test at home, begins the supplements, and when the results come back, the provider adjusts the dosage to meet the patient's own personalized therapeutic need. The patient stays on the two supplements for 90 days, which is the time it takes for red blood cells to turn over, and then gets retested. And if the retest results are in range, they go on a monthly maintenance dose of the two supplements. To begin using the EndFlame program in your office or to have it sent directly to patients at their home, I recommend that you take the survey and you conduct the blood test on yourself to see how it works. Now, the cost of the lab fee will be waived if you haven't already received a free test from us. I'll email you the EndFlame survey to fill out and score it, and then on your console, we'll go over your score, and I'll show you how to recommend the blood test and the two anti-inflammatory supplements using a sample case study EndFlame report. And after your consult, I'll send you a free EndFlame kit to test yourself, and in 7 to 10 days, you'll get your own results. Keep in mind, you shouldn't wait to begin offering EndFlame in your practice because most patients already need this second-pronged treatment protocol to deal with their muscle and joint inflammation. You get all that you need after the consult to start offering the program, the EndFlame symptom survey and the EndFlame dosage chart. So to get your courtesy EndFlame blood test kit and schedule a no-charge 30-minute consultation with me, contact your Meyer DC rep at 800-472-4221. Now, if you don't know your Meyer DC rep, contact Matt Kraft. He's the National Account Manager for Supplements at Meyer at 800-472-4221, extension 5040, or hey, you can contact me directly at 866-410-1818, extension 210, and I'll send you a link to my calendar where you can schedule on your own. This is Dr. Don Hayes, DC, saying, hey, thanks so much for watching. I look forward to talking with you soon. Bye for now.